Lawrence Dave Abugan from Dash 3, Group 4, and today I will be discussing a case study relating to microbiology and parasitology. So, our case situation: a 16-month-old boy was admitted with fever, lethargy, and trouble breathing. A diagnosis of pneumonia was made by physical examination. The child had recently been to Panama and at that time was treated with ceftriaxone for cough and fever. His fever continued despite treatment. On admission, he was given erythromycin therapy. Tracheal aspirate and blood cultures were obtained, but the respiratory specimen contained numerous epithelial cells and yielded normal respiratory flora on culture. A pleural aspirate and blood cultures were positive with Streptococcus pneumoniae, which was resistant to erythromycin and penicillin, and intermediate in susceptibility to ceftriaxone. The patient was given high doses of ceftriaxone and vancomycin and responded to this therapy. So here are the questions given. Number 1. What criteria are used in laboratories to reject sputum and tracheal aspirates for culture? So our answer is, sputum will be rejected for culture if 10 or more squamous epithelial cells per low power field are seen on gram stain. Endotracheal aspirates are rejected if 10 or more squamous epithelial cells per low power field are seen on gram stain. Number 2. If greater than 10 squamous epithelial cells per low power field are seen in a gram stain, but the smear also has numerous white blood cells, which is greater than 25 per low power field, should the specimen be rejected for culture? So our answer is yes, the specimen is still rejected. The quality of sputum samples is determined by the minimum number of squamous epithelial cells and the polymorphonuclear leukocytes per low power field. An acceptable specimen has more than 25 leukocytes and fewer than 10 epithelial cells per low power field. For number 3, in cases of pneumococcal pneumonia, what percentage of blood and sputum cultures is positive for Streptococcus pneumoniae? If the pathogenicity of organisms grow after 24 hours of incubation in the culture dish, the result is positive. Some sample dishes will keep incubating longer, depending on microbial flora present and the need to identify the semi-quantitative isolates and perform antimicrobial susceptibility tests. Conversely, if no bacteria or fungi grow in 6 to 8 weeks for solid culture media or 6 weeks for liquid culture media, the result is negative. Blood cultures are positive in only 20% to 25% of all pneumonia cases that are caused by pneumonia, Streptococcus pneumonia, making it a challenging diagnosis for the clinician. Number 4. The organism was reported as resistant to penicillin and intermediate in susceptibility to third generation cephalosporins. How does the laboratory perform testing for this organism? So our answer is, antimicrobial susceptibility testing is a laboratory procedure performed by medical technologists to identify which antimicrobial regimen is specifically effective for individual patients. On a larger scale, it aids in the evaluation of treatment services provided by hospitals, clinics, and national programs for the control and prevention of infectious diseases. So for our references, here are the links that we use in order to answer the questions. Thank you very much.